from the station that's on your side. This is Channel 7 News Good Morning Arkansas.
Hey, welcome back into Good Morning Arkansas. We're joined today by our good friend, Dr. Morgan Sauer from Baptist Health. And today we're talking about the month of May. It is National High Blood Pressure Education Awareness Month. Dr. Sauer, thanks for taking some time out of your day to join us and talk about this. This is something we've talked about over the years. Unfortunately, it's a recurring problem, and that's why we need an entire month about education and awareness. Can you give us an idea of where Arkansas ranks in terms of high blood pressure and how it affects the state's population?
Sadly, Arkansas ranks as one of the worst states in the nation for cardiovascular health, including diabetes, obesity, smoking, and high blood pressure. Those four things are killing Arkansans in a significant way.
Well, you talk about what it does to the body and leading to heart disease and some of the other factors. When it comes to causes, what's an idea of what people are doing out there that contributes to high blood pressure?
One of the things that's important to remember is that high blood pressure starts very insidiously. You don't feel it. You don't see it. So you have to go and get regular checkups by your doctors to find it early. When you do find it early, don't throw it away. Don't just ignore it. Don't put your head in the sand, because this disease slowly over time damages the vessels inside of your body. When that happens, that increases your risk for strokes, heart attacks, kidney disease. And actually, newer studies are showing that it affects people developing Alzheimer's as well. So it is critically important to get this blood pressure under control.
We hear about it all the time. There are commercials everywhere. And that's what's so fascinating about this, Dr. Sauer. You hear it all the time on TV. Every commercial has a high blood pressure medication, that is advertised into the world. But there's an entire month dedicated to it. What do you think is not getting across to people that is helping them understand the causes of this and some of the ways to mitigate it and hopefully get rid of it down the road?
There's different factors that play into this. First of all, in general, physicians are not aggressive enough at controlling blood pressure. We need to keep blood pressure below 120 on the top number and below 80 on the bottom number. Used to, that was normal. Now that is the ceiling that you're not supposed to go above. Number two, we think, well, I don't feel it, and we dismiss it. We don't want to accept that there's something that is wrong. And this is denial. And denial's never been an effective coping mechanism. The third thing is we have to make the lifestyle changes. And people don't like changing behaviors. I don't. And I understand why this inhibits them. We have to quit smoking. We need to cut down on the amount of salt in our diet. We need to start doing exercise, regular exercise, to bring our blood pressure down. We need to control our alcohol intake. And we actually need to really watch the foods that we're putting into our body. Are they fresh fruits and fresh vegetables and lean proteins that are helping our body? Or is it the stuff that sadly usually tastes really good that we're killing ourselves with?
Well, you mentioned some of the things like you can't see. And you can see people who can look like, they're in shape. They maybe even are working out all the time. While obesity, I know you said, is something that could be a contributing factor to the elevation of high blood pressure, it really, a lot of times, can be people who don't look like they might have high blood pressure, which can be obviously a little misleading out there for people who think, oh, they look great, they don't have it, or I look great, I work out, I don't have it. Importance of regular checkups with that physician really bringing to the point here, right?
You can have younger people, you can have thinner people. It doesn't matter your race. One thing is important, though, when we look at racial disparities, is that we know that African Americans actually develop high blood pressure earlier as compared to other races. And we see the long-term damages that happen more so in the African American community. So we need to be much more aware and much more engaging with the African American community to help get blood pressure under control. It's the same thing that happens to other races. We just need to be sure we're doing a good job for everybody.
And when it comes to knowing your blood pressure, so easily accessible these days, devices, you can buy them online, you can buy them at your local pharmacy. So many ways to know your blood pressure every single day, correct?
This isn't difficult. And the biggest thing to do is to go in, you need to be sitting down, you need to be relaxed. You need to make sure that the blood pressure cuff is touching the bare skin. You don't want to check a blood pressure through cloth. That actually disrupts the ability to read the blood pressure. So get a good blood pressure reading, get your monitor at home, and talk to your doctor. Say, hey, I've been looking at something like the American Heart Association, and they say my blood pressure needs to be below 120/80 to prevent my long-term consequences. How do we make that happen? Most of the blood pressure medicines that we use these days are generic. They're very affordable and very expensive, even if you don't have insurance. So there are a lot of resources that are out there, and there shouldn't be the barriers to success that, unfortunately, we're just not paying attention.
Hopefully we can turn that corner. And thanks again for joining us this morning to talk about it. Dr. Morgan Sauer from Baptist Health. If you'd like to find out more resources, go to baptist-health.com. We'll see you next time, Dr. Sauer. Thanks again.
Thanks, Chris.